As typical in academia, I'm sure, and church, I'm sure people will wander in as we get started, but in respect to our visitor and our speaker, we're going to get the program started. It's really a pleasure for our visitors here to the Graduate School of Social Work just to introduce myself. I'm James Herbert Williams, the dean here, and Dr. Ssewamala, which I'm actually going to refer to as Fred because I've known Fred for many, many years when he was a doctoral student at Washington University. And the problem with getting old in academia is you start seeing how your students start to, what I call sort of grow up, and they become sort of famous on their own. And so we're really pleased that he's able to come back. Well, Dr. Ssewamala is a faculty member at the Colombia University School of Social Work, an associate professor, and he also is a professor in the International Affairs School there as well. He teaches in the area of international social development and practice, covering courses on evaluation of programs in social services, intervention research, and a lot of his work has been focused on asset development and microfinance and international social development practice. He's had funding from the National Institute of Health, specifically NIMH and NICHD, and his research focuses on advancing and broadening the knowledge on social protection, economic empowerment intervention aimed specifically at orphaned and vulnerable children. And I think he's going to talk about a project today that he's doing in his native of Uganda. He's published in several wonderful journals and a very respected scholar in the area of economic and social development policy, and a graduate from Washington University, which is where I had the wonderful opportunity of first meeting Fred as a student. So we welcome him here today to speak as part of our lecture series, Dr. Fred Ssewamala.
Thank you so much. Thank you so much for that wonderful introduction. As you can tell from my accent, I'm from Boulder, Colorado. So for those of you who are from Denver, then you are in trouble because you may not pick my accent. But those from Boulder, they'll be able to pick my accent. So I'm very, very honored to be here and to have gotten this invitation to come and share my work with you. With all seriousness, I'm originally from Uganda, so that tells you where my accent is from. And so what I'm going to do today, I want to take you through some of the work that I've been doing. The work has been supported by the US government, and also the work has been supported by, I feel my heart is pumping because a family which keeps supporting my work for the last 7 years, Mark and Barbara Arnold, they came all the way from Boulder to at least attend the presentation. So thank you so much for coming. Exactly. So, so what I'm going to do really is to take you through the different projects that I've been participating in, that I've had the pleasure of designing and implementing and evaluating. I want to keep this to 45 minutes, no more than that, so that, because I understand we may have some students who have to go out around 12 o'clock. So I want to give those people a chance also to ask questions. And also I feel that, although I'm a faculty, I like to hear myself talk, but sometimes, because when you're talking about your work, you get excited. Not everyone gets excited. So it's sometimes good, keep it brief, and then people will ask questions, and some of the issues may come out during the question and answer part of the session. So I'm assuming that this clock works. So, all right. As I start my presentation, I want to give you an exercise. It won't be graded, but you'll grade it yourself mentally. I want you to think about a child. I want you to think about that child in poor Sub-Saharan Africa. Sub-Saharan Africa. I want you to imagine this is a child. The child walks 4 miles one way going to school, and 4 miles coming back. They walk. And when that child gets late to school, they are caned, they are punished. And then when they come back home, every day they have to fetch water, they have to fetch firewood, and then they have homework. Now the question I want to give you is, what is it that will keep this child going? What is it that will keep this child persevere, go through that hardship from grade 1 to grade 7? I'm from a bridge system, so we have 7 years of primary, 6 years of secondary, and then 3 years of university. But don't even go to the university. What will keep this child, even if school is free, primary 1 through primary 7 is free, what is it that will make this child think about the future differently? That, you know what, it's worth going through this. So that's the child we are going to be talking about today. And if you don't have one, I want to pick any one of these kids, any one of them, have them in your mind, any one of them. That's the child you should work with as we go on, okay? One of these and one of these, okay? Same thing. So when you look at Sub-Saharan Africa by the year 2100 will have 35% of the entire global population will be on the African continent. That's a big, big number. Because in 1996, Africa bypassed Europe as the second biggest part of the continent. So right now, it's on a steady growth. And when you look at the growth, where the growth is happening, it's mainly around the young, okay? Ages 5 to 24, okay? So you have what we are calling that big demographic trend of the young ones growing up. Now, the issue is not about how big the population is. The issue we should be concerned about is how do we take advantage of that? In economics, they call it the demographic dividend. Because a big population can be good because it stimulates production, stimulates consumption, stimulates demand, and all that. But a big population, which is characterized with kids who are dropping out because they don't have the resources, because they are orphaned, should make us pose the question of how do we take care of this? The biggest number of orphaned children, really in terms of a percentage, is in Sub-Saharan Africa. And mainly, most of these are getting orphaned as a result of HIV/AIDS. Now, HIV/AIDS is slowing down, but the people who are already infected are too many that they are dying and they are leaving behind kids who are orphaned. So when you go back here, my concern is not about this big number. I would be concerned about that. But my concern is about those ones you guys in English call the ones who are dropping out through the cracks, okay? Those ones who are not going to have the funding to afford secondary school, or those ones who are not going to have the funding to afford a better life. Those are the ones I'm focused on, okay? So the steady increase in these numbers is overwhelming an extended family system. I grew up as an orphaned child, but you know what? When I grew up back in the 80s, my uncle was able to take care of me. I wasn't a biological kin, but they were able to take care of me. But right now, when you go and look at orphaned children, most of them are on the streets. They are dropping out. You find them when you go to Sub-Saharan Africa. This child that I just told you about, eventually they are going to drop out and they'll end up on the streets. Unfortunately, when kids are young, you know, they have premature thinking. So they think, you know what, I'll drop out, I'll get on the street, I'll start working in the city. They don't know that, you know what, working in the city, you need marketable skills. You need to have the skills. They don't have the skills, so they can't be employable. Leave alone, even people who are graduating from the universities don't have jobs. How about these kids who are dropping out of school? All right. So this whole situation is creating what I call a child crisis, where you have the extended family overextended, and then it's not taking in kids like they used to do, like they took care of me, and then they're ending up on the street or they're ending up begging. So in all my work, I'm a social worker by training. But I think that where social work sometimes where we go wrong is by thinking that we'll work with only one sector of the society. That, you know what, we'll work with the state, public welfare, or I'll work with non-government organization. That's fine, but my argument always is, if we are going to have sustainable interventions for these kids, we have to make the market get interested in them. Somehow, we need to make sure that the market, okay, the state, the family, and civil society work as a collaboration. We cannot simply think that society will take care of them through tax system. That's one way of thinking about it. Or that we'll use your donations like the Marx do and you work through civil society. That's great. But if we don't take care of these kids using the market as one approach also, then we can't be thinking about sustainable interventions. So all my interventions, what I do, I work with the market. First of all, I work with the state. We work with public schools, and we do that. We work with civil society, churches, non-government organizations. We work with the family, that's a given. But I also try to interest the market in these kids. And the question is, Fred, what do you talk about? What do you mean by the market? Financial institutions, which are going to look at these kids as, you know what, if we bank them early, or if we create products where their parents can come, then we'll be able to make a profit off of them. It may not be big at the moment, but eventually we'll be able to make profit out of them. So I'm going to explain how the market works, and you'll see the collaboration throughout my talk here. So going back to the question I asked you, what will make this kid think and behave differently? One way of looking at this is when this kid has the resources, even if they go through the hassles of life, if you give them the resources, you create the resources in their lives, they may think and behave differently. And that's work which is guided by asset theory out of Michael Sheradin's work at Washington University, who was my dissertation chair. The way you should think about this asset theory is when people own resources, they are more likely to think and behave differently. I always tell people it's not by accident that we have the highest HIV rates in the poorest regions on earth. Go to Sub-Saharan Africa, it's one of the poorest. Go here in the US, where, you know, go to South Bronx, go to East St. Louis. So there is something about poverty that makes people lose hope and they get involved in stupid stuff, okay? Or in stuff that they would otherwise not get involved in if they had the same opportunities like me and you. So the other thing that the way you should think about asset theory is when people think about the renters and the homeowners. If you rent, you're like, you know what, I'm here today. You may not even participate. You call them neighborhood watchers. You may not even care that much about it. But if you own a house, the moment you see that, you know, there are some activities going on very suspicious, you are going to call the police. Or you get more involved. You have a stake in society. So when you have a stake in society, you are going to think and behave differently. So even this child that I gave you, I told you to pick, think about it that even if they walk long distances, if you give them a nest egg and you make them think about life differently, they will say, you know what, at least I have the resources which will take me to the next level. But if you keep telling them that, you know, life will be okay, don't mind, without them having the resources, that's work which is done by pastors in terms of counseling and reverend fathers and all that, you know, because they promise you the heaven is great, which is great. But some people don't think that, you know what, I will sacrifice my life till I go to heaven. They want to know, how is it that I'm going to go through life today? So that's the thinking about asset theory. So when you think about asset theory, think about it in such a way that when this child, that poor child, is given the resources and the skills to use those resources, that child is going to behave and think differently about life, okay? So that's the thinking. Then the other part that I wanted to connect here with is the institutional theory. And the institutional theory here would state that most people would do well if you give them the opportunities, okay? So I was telling someone that my wife and my stepdaughter, hopefully one day we get to retire. When we retire, then Aliyah, my stepdaughter, may say, oh, Fred, you were very bright, a very wise guy. I say, why? Because look here, you saved, and now we are at a beach somewhere enjoying. And I'd say probably it wasn't me making a wise decision. Why? Because I know that when I got a job at Colombia, they gave me a 401k plan, and Colombia started matching part of my money. Okay? That's an institutional, a deliberate institutional mechanism that probably someone who works at McDonald's doesn't have the same institutional opportunity that I have. So even these kids, that if you give them the same opportunity and you give them the resources, connect them to the resources, they will do just as well, if not better than even Fred has done. That's the thinking about this. Okay. So I've been trying to test this work through different projects. And one of them was a very first study which only had 97 kids. And in this study, I'm a researcher first of all. So I always tell people that, when I do work, I always tell people that I'm not simply doing, I have a good heart, but at the same time, if you are going to influence policy and programming, you need to do some rigorous research and show that, without my intervention, this wouldn't have happened. Or it's because of this intervention that we are seeing over and above whatever would have happened has extended by another 5%. So if policymakers are interested in influencing the government, influencing society by that 5%, then they'll come in and work with you. So for as long as you work with poor people or low-income families, you always have to test it. You don't have the luxury of like what Barack Obama did or the government did of helping out the Wall Street without really having a precedent. No, you don't have that luxury when you're working with the poor people. When you're working with the poor people, they'll say, show us the evidence. So what I've been trying to establish here is the evidence. So here, we start with 97 kids. We put some in what we call a treatment group and others in a control group. Those ones in the control group, we give them what every other orphaned child would receive: textbooks, exercise books, school uniform, and all that. Then those ones in the treatment condition, we give them an extra opportunity of saving in a bank, teaching them about financial management, and on top of that, give them a matched savings account. And what we are trying to do is to compare the two groups. If you give this child a savings account and the financial management skills that go with it, will this child do better than the one who gets what you call usual care or normal care, or whatever it may be, okay? So that's how I designed that study. The success of that study, that study started with about $8,000. So it was very small amount of money. No one was believing, and so it was interesting. But based on that study, we got some positive results, and NIH was interested. And so when I applied to NIH, I always tell my doctoral students that if you have the preliminary data, pilot data, you'll get funding, okay? So I then applied and then extended that work to about 300 kids, okay? And I'm going to talk about those kids today. And then from that work, I extended it to about 600 more families, okay? And that's also funded by NIH. And from that work, actually, like I'm making a presentation here, and I put my work on the website. Then I was approached by the World Bank. They said, you know what? We've read your work. I said, okay. And the way you are applying asset theory has never been applied that way. And could we use the same conceptual framework in Nigeria where there is oil production? And I said, what is that about oil production? Remember, we are talking about the market now. And they said, this is what's happening. Most kids in Nigeria, in the southern part of Nigeria, Bayelsa and River State, they are dropping out of school. And when they drop out of school, they disrupt oil production. And when they disrupt oil production, it affects the world market in terms of oil. So can we create resources in the minds of these kids, keep them in school so that they can think about the future differently, other than thinking, you know what, even if I drop out now or I drop out later, the future is the same. So why don't I drop out now? Because it's about opportunity cost. Why don't I drop out now and go and join the militia? So you'll be competing with the militia. And I said, okay, great. So then we got to work with Bayelsa State and established over 1,000 accounts for kids in Nigeria, which was extremely exciting, and it's still very, very exciting. And then based on the work I've done in the past, then last year, I received extra funding now to extend this work to over 15 to 2,000 families in Uganda. So that's how it has been progressing from a few hundred, from actually less than 100 kids to where now we have taken over, be very big. I want to talk slightly about this study, study number 5. That study, the MasterCard Foundation approached us. And the MasterCard Foundation said, you know what? We are looking at the growth in Sub-Saharan Africa. Think about the demographic dividend where I started. That's where growth is going to be tomorrow. Tomorrow, literally, you know, like 10 years from now. And whoever gets it now will control that market. So what they are thinking is, if they gave you that not credit card, if they gave you that logo of a MasterCard, won't you always think that as a child that, you know, MasterCard is my bank or MasterCard is my whatever? That's the thinking. That's the marketing grid they are doing here. So don't tell them. So they approached us, and we are doing this work in 4 countries. In Colombia down south, 2 countries on the Sub-Saharan Africa, Ghana and Kenya, and then in Nepal. And the way they are looking at this is, how can they, in fact, it's the first study where the market is creating the product, working with us, not us creating the product, but the market is creating the product which is acceptable to the young adults, and then we are looking at the outcomes of that product on the developmental impacts of the young adult. So very social workish, but combining it with the market. So that's how we are dealing with this. So we are not marketing for MasterCard, no, because we are not giving them credit cards. What we are doing, like most of you know, how many of you change banks? You know, your first bank, you always think about your first bank. So if MasterCard can get them early, then they will always think about MasterCard, even in terms of financial services. So that's the thinking here in terms of the Youth Save product. I mean the Youth Save. Okay. So when you look at this work, really, it's work which started here in Uganda, and now it's expanding in different places. That's how I look at this. Okay. So I won't spend time on this, because this is exactly what I just told you about, you know, growing up poor and ending up in poverty, and the intergenerational transfer of poverty. And but I want to spend some time here. So the MasterCard argument, or the market argument, is, why are financial institutions interested in working with Fred, who is working with poor kids? So this is what they tell me. They are not going to make profit now, no. But in terms of banking, they are thinking that they want to bank them early, and they will have them for life, okay? Or if not that, if a child comes in and I introduce them to the financial institution, then they're more likely, the banks will have what you call cross-selling to their relatives. So they'll have other products. So banks will be able to make profit off of other relatives, not necessarily from the kid. But the kid will be what I call financially included. Because there's no way. I was talking to a cab driver today, and as he was bringing me here, I said, Fred, everything is getting expensive. I said, why? I mean, what do you mean? Because when I used to go back to Ethiopia, he's from Ethiopia. When I used to go back to Ethiopia, I would have a meal for $1. Now I can't even afford a meal, because, I mean, you can afford, but literally saying the meal in the last 4 or 5 years, now meals at $4, $5. It's like you are living in the US. I said, you know what? Because now everyone is getting financially included. People are now thinking about modernization, if you want to use that word. And then people are moving from rural areas and that kind of stuff, and they're getting financially included, and they have to interact with the financial sector. So that's one way of thinking about it, that, you know, the cross-selling argument, and then also how people build resources and that kind of stuff. Okay, why am I focused on education? At the micro level, education is a protective factor. We know that when kids stay in school, they can always use school as a protective factor. It's also a vehicle for imparting positive public health knowledge, and it's also associated with higher earnings. The higher you go, under normal circumstances, there are some, you know, sports players and all that. That's a different thing. But under normal circumstances, higher education is associated with higher earnings. Then at the more macro level, I was talking to people recently. I was in Berlin and working with a German bank, and I was talking to economists, and I was asking them, how come we haven't gotten call centers in Nairobi? At least forget about Uganda. but call center is in Nairobi. And they said, you know what? Yeah, we still have about 10 years to go because the level of education in Kenya is not the same as the level of education in India or Singapore. So it's more cost effective to do it in India than going to Kenya at the moment. But so at the macro level, we are losing out by having an uneducated population. So that's why I think that education here makes a big difference. It will make our countries more competitive. Okay. So, all right, I still have some 20 minutes. Okay, so what is this project, the one I talked about, the second one, Subi project? Subi means hope. It's a Luganda word from where I come from. Hope, because when I went in, the first study, I called it SEED, Saving for Entrepreneurship and Down Payment. When we went back, during what we call refresher, what we call booster sessions, the kids told us and their parents, the project, they really insisted that you're not doing research. I said, no, we are doing research. They said, no, because most researchers, what they do, they come, ask us questions, they disappear. They come, ask us questions, they go away. But for you, keep coming back. So, and also you have connected us to financial institutions, and you are allowing us to save. Because when they save $1, we match it by $2. So they have $3. When they save $5, we match it by $10. They have $15. So it's like they handle, I mean, they are holding it up here, we are helping them. It's not that we are doing everything for them. No. They have to contribute, we also contribute. If they save $0, we give them $0, so they have nothing to lose. And so the kids told us, you know, because you are creating a sub in our life. I said, oh, okay. They kept saying that over and over and over in our qualitative work. And I said, you know what? Then we should call this Subi project, because the kids themselves and the parents are saying Subi, Subi, Subi. So I discarded the name I'd brought all the way from New York, and I started using Subi. Okay, and this is where we work. We work in Rakai. We started here. What is special about this place? This is where the first HIV/AIDS case was reported in Sub-Saharan Africa, back in early 1980s, around 1980. That's where it was reported. I don't know whether that's where the first HIV case was ever, but that's where it was reported, first reported. So when you go in that area, although the prevalence rates are going down in other places, here, in terms of HIV/AIDS, they are still very high. And you have a lot of kids who are either on streets or child-headed households, or simply double orphans without any parent. And we have a lot of them who are single orphans as well. So that's where I'm working. I don't work with institutions in that we don't work with kids in institutional care, no. Because I think that, to me, as a social worker, I always think that what you want to see is what you design. And if we worked with orphanages, it would mean that we are telling communities and families that bring your kids in orphanages, that's when we'll take care of them. Then I don't work with street kids. And that's me. And the reason is that if I'm going to intervene, and I can only intervene with kids who are on the street, then what I'm telling kids and the families is, send your kids on the street, that's when I will intervene. I work with kids when they are still with their families, sending a signal that you can also be helped, provided you are doing your part of taking care of this child. So we work with kids in families. So that's my way of thinking. But also when you look at academia, and the criticism of institutionalization, studies over and over have shown that it has a negative psychosocial impact on kids. It's also extremely expensive. You have to hire everyone from a cook to a sweeper to a building and that kind of stuff. So that money would best be spent in a family care setting. Then the other thing that I don't do, I don't simply allow kids to receive without giving back in terms of contributing. So it's a partnership. So in doing this, what I'm trying to do is to explore a new approach of care, of empowering the communities and the families which are taking care of these kids. From the traditional way of doing it, either put them in an orphanage or give them the second-hand clothes and that kind of stuff. So all that is good. It has room somewhere. But at least in my research, that's not what I'm doing, okay? In fact, till recently, UNICEF has also come to realize that, you know what, I'm doing work in Azerbaijan, former Soviet Union, and they are doing what you call deinstitutionalization of kids, whereby they are no longer encouraging parents to drop off their kids into orphanages. They are trying to figure out if the reason for institutionalization we know is poverty. Why don't we address issues of poverty when kids are still within their families? Okay. All right, so I just talked to you about briefly, but let me explain how the savings account again work. We bring the parents, remember it's an institutional piece, so we bring the parents to the schools, and we bring the banks to the schools. Because there is a reason why some people don't go to banks, because sometimes you know what they think? They think that banks are for rich people. So what you want to do is to narrow that gap, create the confidence, and then parents can start interacting with the banks eventually. But we bring bank officials, then they open up accounts. This is a lady who is taking care of these kids. And this is a sign of someone who cannot read and write, so she's using her thumbprint as a signature. And this is a bank official. By the way, I don't have any royalties or anything from Coca-Cola, so I'm not advertising for them, okay? So, and the way I'm thinking about this is that when you increase or create children's savings accounts, you are going to strengthen their financial stability. Then when someone is financially stable, then they are more likely to engage in school with a better, clear mind, and then you register better educational outcomes and healthy functioning. That's the pathway that I'm envisioning here. So these are the intervention components. The usual care I talked to you about, we give them school supplies, books, uniforms, lunch. We give them the normal counseling. We give them what we call primary health care messaging. I brought some pictures here, you'll look at them, which deal with what I call the talking compounds. Talking compounds, like here it says, no and exercise your rights. Say no to sex. So these are all over the school. Like here you see pictures, these are the pictures. I couldn't, by the way, put it in the PowerPoint. Be smart, be kind, act like a human being. Punctuality is the key to success. Delay sex. So that's every student who goes to school gets access to those messages. And if you want to see the pictures, you'll see here, okay? So that's usual care, that's a given. Over and above that, okay, we give them the children's savings accounts, we give them microfinance training, and then we give them about business mentorship and that kind of stuff. So this is what is the added intervention. All right, I won't spend time on this. So the way it works to make sure that people don't abuse the money or misuse the funds is we open up an account for the child. Then we open up what we call a master account, another middle account. When the child puts money and their parent in their personal account, which you opened using $10 to $25, depending on the bank, then we put a 2-to-1 match rate. Put in $1, then we put another $2 here at the end of every quarter. When they put $50 here, we put 100 here. Now, they have access to their money so that in case of an emergency, they can access that money. They don't have access to the money we are matching in physical terms. They can't sign and get it. Because we don't want people to abuse their accounts because they are marrying a second wife, or because they are buying Christmas presents, or because they are doing whatever. So what happens is, when they are getting whatever, either an education or starting a small business, we get their 2/3 of whatever it's going to cost from this master account, and we take it directly to the vendor, and they get their 1/3, because it's a 2-to-1 match rate, and they take it there, and then they have the 100% that they need. So that's how we do it. And we do it so that we can avoid abuse of the matching funds, okay? The same way that, 401k doesn't work exactly that way, but when you access it early, you get a penalty. So we try to be able to design this that way. Okay, the other thing that we do is this mentorship, very small groups of mentorship. And by the way, that mentorship was asked for by the kids themselves. They said, we wish we had a big brother or a big sister in our local language. And we said, you know what? We can adopt something like big brother, big sister in Uganda. So we do that for them. And then we meet with parents on an ongoing basis, parental. And when I talk about parents, you'll say, Fred, you talked about orphaned children. Yes, for us, anyone who takes care of you is considered your parent. So that's how we look at it. Then we talk about more about savings than credit, because we think that savings are better than simply taking out loans. And then we give them microfinance training. I won't spend a lot of time on this, but the way we have done this, we collect data using both administrative sources and also in-depth interviews, and we also do surveys. And this is how we have done it. So in order to make sure that our randomization is clean, we do a baseline. We survey all the kids that we have selected. Then we randomly put them in 2 groups using the SPSS Future computer, so I don't know any. And then what I do here, then some of them are going to end up in the SUBI program, and some of them are going to end up in the usual care. In order to avoid, because kids from the same school are going to be highly correlated, they will have the same futures. So what we do, we randomly select at the school level. So all kids in a given school are going to receive the same intervention. So that allows us to avoid the whole issue of contamination and social desirability and all that kind of stuff. So we randomly select them. So right now, where we have about 50 schools, you'll have about 25 and 25. So all kids in 25 schools will receive the savings accounts and all that, and the other will receive the uniforms and all that kind of stuff, okay? All right, so for the study I'm going to talk to you about, we started with close to 300 kids, 289. Randomization, 3 of them declined to participate, and the reason, by the way, they declined, they said it was too good to be true. No one can give you free money, so they just said, no, we won't participate. Just said no. Not actually the kids, but their caregivers said no. There must be something hidden about that, which is totally understandable, because these are communities which have been taken advantage of by non-government organizations which come in, promise, and they never deliver. So these ones just declined, and then we ended up with 287. And then we assigned, because we are doing it at the school level, so 138 ended up in the intervention, which received the accounts, and the other one ended up in the usual care. And at follow-up, we had lost 3 here, we had lost 6 here, and so the numbers that I'm going to show you here are from 247. Here, why is it that the dropout after only between 10 and 12 months is so small? Because we are working in rural areas, which tend to be more stable. If we are working in urban areas, then it may be slightly different, because people keep moving. But rural areas, they tend to be stable. And also, these are still kids in school. So if it had been kids on the street, that would slightly be different, probably. I won't take you through all that. This is the academic lingo, but it's really looking at the measures, how we are able to capture that, and we also have the alpha levels there. So we have the control variables, we have the outcome variable that I'm going to share with you. We have a lot of publications, but I'm only going to share with you one publication here. Okay, I won't spend time on the data analysis. So who are these kids? All right, this is one of the papers that when you get a chance, you can read this paper. It appeared in Social Service Review, but 57% of the kids are girls. Since I haven't given you an assignment, and I want to make sure that I have 5 minutes left, because I promised 45. Why do you think there are more girls? Why do you think there are more girls? Since since this is not a classroom, it's a presentation, let me tell you why. Because we are entering at the primary school level. At the primary school level, when it's still free to send the kids at school, parents will send everyone. If we are entering at secondary school, so the way the education system is set up in Uganda is primary school is free for whatever it is. They may be studying under the tree and all that stuff, but it's free. Secondary school, you pay money. Okay? You have to pay, and then the university, if you work very well, you may get a scholarship and have it for free. So, because unfortunately, these are patriarchal societies which put more emphasis on the boy child than the girl child, when it gets to primary school, they'll send everyone. When it gets grade 6, grade 7, they pull out the girl, either marry them off or send them to work as housemaids or whatever. Because they think that investment in a girl won't bring as higher returns as investment in a boy, unfortunately. So, if you are going to capture the girl child, for them to benefit from development, you want to approach them when they're still young, before the parents get that second thought of pulling them out of school. So because that's what we are doing, that's why we have a slightly higher percentage of girls, because there are more girls anyway in schools. But if I had approached them in secondary school, then we would have more boys than girls. Then 81% of them report a father not living. So the question is going to be, but Fred, you told us these are all orphans. Yes, we are using the definition of UNICEF, where a child who has lost one or both parents, okay? So some of these kids have a surviving mother, some of them may have a surviving father, but they don't have, at least one of them, one of the biological parents is dead. It's not simply they can't trace them, no. Like the work I do in Azerbaijan, it's simply, oh, the parent feels that they don't have enough money, it's the former Soviet Union style, take them in an orphanage. No, here it's simply, you have lost a father or a mother. And in this case, due to HIV/AIDS. Okay, so those are two numbers that I wanted to highlight. You know, you are talking about kids who are, on average, about 13, 14-year-olds, okay? Although you have even young ones which are 11, but this is on average. So one of the outcomes that I'm looking at is, can these kids save? Yes, we are going to look at the results. But how do I calculate that? What I do, I get how much they have deposited, I get the small interest they get, I take off the unmatchable withdrawal. Remember I told you we match $1 for $2 per dollar, but we don't match it endlessly because we don't want someone to go and get a loan and put it there and say, Fred, we put there 10 millions. Okay, I match our money. No. Within the Ugandan context, we know that someone cannot save more than probably $10 a month. If that. So we say we can only match if you save up to 20,000 Uganda shillings, which is an equivalent of $10 a month. Because we don't want you to sell your land and that kind of stuff. And that's reasonable, because if you save that for a year and you don't, you know, fall behind, then each year you save is going to give you at least 2.5 years of education, which is great. So that's why I put off whatever is over and above what is matchable. And we divide that by the number of months of participation, just to control for the period that the kid has been into savings account. Then we also look at educational plans. Are these kids, do they plan to go to secondary school after completing primary? Then we look at I like this because this is actual data from the schools. It's administrative data, so it's not simply kids reporting, but we get it from the schools. And also, by the way, the bank data, the bank data, this one, is also comes from the banks themselves, so it's not self-reported, which is good. Then we look at school attendance, and this is something I want to highlight here. When we had just started with SEED, we could go to the schools and say, could we have the registers for the kids? And so that we can roll call and see how many times they were there. And then teachers, whenever they could hear that someone from SEED is coming, they would run away. And we would say, why? Because they thought like we are inspectors. And we said, no, all we want to know is for us to be able to tease out whether our kids are doing better than others. So what we decided now, we do unannounced visits. We just go to the school, roll call to see whether the kids are there, and then when we find you in the school, we give you books. If you're not there, you miss out. So this data is more accurate than the one we used to get from school registers. All right. Then risk-taking behavior is a very interesting one, because we wanted to know whether kids, going back to the theory, and going back to the child that I told you about, whether this child will avoid risk-taking behavior of getting involved in sex and all that kind of stuff. Now, what happened was, all the kids were telling us, no, I'm not sexually active. I'm not involved in that. I'm not. And then when we could put in a checkout question, check them and say, how about your colleague or your friends? Give me 4 names, oh, so and so. It's, oh yeah, she's sleeping around, she has everyone, and that kind of stuff. So everyone else was involved in sex, but they were not. So the question was, how do we capture this really? Because we could see there's some sense of social desirability here. So what we decided to do now, we no longer ask that question. What we do, we give them the questionnaire, they fill it out, they see it, and we tell them it will be opened in New York. So we have started getting better data out of that because the kid doesn't want to be judged in terms of issues of sex. So it's very, very complicated. So in this study, because we didn't get good data on sex, we ended up using sexually taking intentions, which are not the best measure of sex behavior, but close to, okay? So savings, are they saving? Yes, they're saving an average of $6.33 a month, which really translates into $19 after the match, which is a lot of money in a poor country like Uganda. And where are these kids getting their money? Most of them are telling us they're raising things like pigs, things like rabbit, chicken, and then others have become more intelligent than Fred. They are writing to long-lost relatives and saying, you know what? I don't want to visit you over Christmas. And I don't want a shoe on Christmas. Just give me 1,000 Uganda shillings, you'll have given me 3,000. How? Because I have a match which gives me 2. So they are calculating it that way. And they also they told us that others are using the other method of saying, if you deny me 1,000, you have denied me 3,000. So they are being very mathematical calculating. So, and we don't see any difference between girls' savings and boys' savings. So boys save $6.33 and girls $6.88. So the differences are not statistically significant. We also don't see any difference between double orphans and single orphans in terms of actual savings. So in terms of educational plan, this is when we went in. We went in, so these kids were all almost at the same level. This is the treatment group. This is the control group at baseline, 78, 79. We go back 12 months, 10 to 12 months later, 89% of the kids have clear educational plans in the treatment group. 65% of the kids in the control group have lost those educational plans. Now the question is, Fred, what is bringing about all that? It could be resources, it could be other things, but something is happening. Now, how sure are they about those educational plans? We see that for sure 87% of kids who are participating, receiving the savings accounts are very, very sure, and these ones are really not very sure. And what does this mean? I just came back from Uganda, and whenever I'm going to do a presentation in a big group like this, I want to rehearse it with my family. So I was rehearsing, and they said, "Oh, Fred, what happened there?" I said, "Think about it when we were growing up, okay?" Because I use this example all the time, so you may have heard about this. Think about it when we were growing up. Each one of you, when you were 14, 13, you wanted to marry the richest person on earth. And you are thinking about the richest person in the village. When you turned 20, you were like, I'll go with a teacher even if they don't have good shoes. Then when you turned 30, you are like, I'll go with, okay, not a teacher, but I'll go with someone even lower than a teacher. When you turned 35 plus, you are like, I'll go with anyone. So reality sinks in. When you are still young, you have these, you are dreaming. But remember, when we go back 12 months, 10 months, reality has started thinking in about the resources. Can we really get it? And 24 months later, our studies show this even goes down compared to anything else. In terms of primary living, the kids in the treatment group are getting 2 percentage points better, which means that is giving a chance either to get a government scholarship or not to get a government scholarship. So the kids in the control are performing badly in terms of educational performance. In terms of actual school attendance, here this is noise in the data, but there's no difference really. But when you go back, you see that although the intervention is not showing any impact on school attendance, the unannounced visits, what we see is that at least it has consistently remained that way. They have consistently been attending that way. So the numbers have not changed. But for the treatment, the numbers have gone down. With time, the numbers fall down. So I think these are results that are worth thinking about. In terms of sexually taking intentions, remember, for behavior, we couldn't capture the best because everyone is not having sex. But for intentions, we see also a difference here, which is kids in the treatment group are less accepting of risky behavior compared to kids in the treatment group. I mean, compared to kids in the control group who are more accepting of risk-taking behavior. So, which is really, this paper appeared in American Journal of Public Health, and it's highly cited. Okay, now, to wrap up, you should understand my work as a Campbell meal. I cannot disentangle the role of savings from the rest of the items. What I know for sure is that that combination is pointing to some positive direction. Think about it this way. You go to McDonald's, you ask for a burger, it has bread. It has an onion. Sometimes you may say, no, I'm going to kiss my partner, I don't want onions on them. But it still has cheese, it has something. And sometimes you also have a drink, and you come back full. The question is it the bun? Or is it the meat? Or is it the onions? You said no. So we don't know. So in this case, I cannot disentangle. What is the role of the accounts by themselves without mentorship? No. And do I want to disentangle that? Probably not. Probably that entire package should go that way. For example, for the students who are here or the faculty, your experience at the University of Denver may not be complete until you interact with Dean, our lovely Dean. So do you want to remove the Dean and say, let me see my experience? Probably not. So that's, you should think about it in terms of that Campbell meal, okay? So we cannot disentangle. Then also the relatively short period of time, you know, we would like to look at this 10 years, 15 years, 20 years, okay? So that longitudinally we can see really do these stand up in terms of asset development. Then we have also a lot of self-report. Remember, I told you about sexual staking, where everyone is not having sex, but all their friends are having sex. So the implication here is, at least we are starting to see the initial results of economic empowerment of orphaned and vulnerable children. We are seeing something is happening. And we need, of course, more money, and hopefully with SAVE, which is doing it in, where we are doing it in different countries, we'll be able to see how this works in different contexts and that kind of stuff. But right now we are seeing something happening. And then the positive impact should be understood as a package. I always want to emphasize that. So we need longer studies, we need to disentangle the effects of the different components. We need to study now out of school youth, because I'm focused on in-school youth. Then we need to think about a lot of technology. Maybe we don't need now to bring all the kids to schools. I mean, parents. Now there is telephone banking, and which is going on in Kenya. So we have not taken advantage of that. We have a big African community outside the UA, I mean outside Africa. So how can we take advantage of remittances? People are sending us remittances and all that. So maybe these are areas that we need to be able to explore. And I really then need to acknowledge all the funders who have helped me, the National Institute of Health, the individual funders here, including definitely the Mark and Barbara, and then they're in Denver, so I told you I didn't say Boulder, but you know, somehow Denver. And then also other support from my colleagues here that you can't do this kind of work by yourself, so you always need support from other people. So these are some of the publications that this work is being where this work is being published, and I want to thank you for listening. So I welcome questions, clarifications. Yes, ma'am.
I have a two-part question. One is there a percentage estimate of kids who are HIV positive, and can HIV positive kids participate in this project? Yes,
that's a good question. One, we don't test kids for HIV, for whether they're HIV positive or not, because, and the reason we don't do that is because of low supplies of ARTs, the drugs. If we found out that a child is HIV positive, what do? Do we just let them survive without the medication? Because ethically, if I find out that they're positive, then I should be able to connect them to services. But without services, then I don't want to test them. So I don't do that. Although my new work, I'm now going to be dealing specifically with kids who are HIV positive, because other people have done that kind of work, say that the results may be slightly different, because also this may allow them think about their medication differently. So we don't have the estimate of kids who are HIV positive. But that's a very interesting question, because my new grant, I was reviewing literature. I didn't realize that actually even poverty is impacting people on how they take their medication. I understand some of them, because when you start ARTs, your appetite increases. When your appetite increases, you must have food. And if you are poor, then you can't afford that. So I understand some people are deliberately refusing to get tested because they don't want to decide between I'm positive and where will I get food for me to be able to keep on the medication. Okay? So it's very interesting, and that's a study I want to explore. Yeah. Yes, ma'am.
Do you have any application to the control group as far as kind of what happens with them after the study?
Yeah, actually the obligation I have to them, because I'm not taking away any services that they are given. In fact, over and above what they would receive from usual care, I'm giving them steady school uniforms, thanks to the funding that I'm getting. So uniforms, I'm giving them lunch. Whenever you could go to these schools, in fact, if I go with you, you'll find that most of them, during lunchtime, they are sitting under the tree, the shades, waiting for the next break, because you take a break at 12 o'clock, and then you go back to class at 1 or 1:30. So that lunch hour, most of them don't have anything to eat. So because they don't have anything to eat, and you know, $5 can feed them porridge for an entire semester. $5. So I fundraise and I give them that. And then I give them uniforms. And the uniforms that we give them, okay, you see that all of them, of course, are wearing uniform in a way. The uniforms, some of them use them as the clothes, the best clothes they have to go to church, to visit relatives, and that kind of stuff. So my obligation is to give them the best they can under usual care. But I don't have an obligation in terms of accounts, because really I'm not taking away anything from them. Okay? That's how I look at it. Yeah, although the other design would be a delayed intervention, where you'd work with them, and then after 2 years, then also go back to the control and give them the accounts in a way. So that could be another method that one can consider, but I haven't done it that way. Yeah. Yes and yes, please.
Hypothesis be around how your study might work in a place like Kagera, or let's say a community that would be considered even an illegal community or an unrecognized community or a slum. Would you anticipate similar results?
Yeah, I would definitely. There's no reason why I would expect worse results. I would err on thinking that you'll get similar results in that. Let's think about society, the way society works. Do we really always think about our individual first before we think about community? Or do we think about community first before we think about individual? I think that, forget about capitalism, because, we know that socialism is failing, but forget about capitalism, because it was also failing at some point. I think that people, in most cases, they will think about me first, and then think about my community. So what do I have? So even in Kabira, in Kibera in Kenya, that's the one you are referring to, where the slums, if you gave them the opportunity and you helped these kids come up better, then the entire community eventually will benefit. That's what I think. Then I always laugh at people who say, let's construct the schools, and let's construct the schools, let's construct the roads. Even if you construct the roads and the schools, when the families are not empowered, who is going to use those schools? That's a question, unless you are going to make everything free. So, but if you empower the communities, the individuals, then the individuals themselves actually can advocate for that, and in fact, sometimes they can contribute to that. So, would the results be similar? Using asset theory, I think they should be similar. That's what I think. I think that individual investment will eventually lead to the general good of society. Although, of course, even if you do the general good investment, can lead to individual, but I think it's it takes long to trickle that way. Does it answer your question? Yes. Yes, please.
You consider the third group, so you have your control group, your test group, and then a second group that gets the mentoring and the business the training. but they don't have the incentive of the matching. And the reason I ask that is, assuming that you were to roll this out on a massive scale, the matching program would probably be unsustainable, or presumably, right? So do you compare what the savings rate would look like without that incentive, the matching incentive?
No, actually I've not. And the reason I've not done that is, one, the matching rate won't be unsustainable. I think we have the resources to do it, because they're doing it in Singapore. They did it in the UK Child Trust Fund. They're doing it in Canada with some selected groups. So I think it can be sustainable using the tax system. I mean, you look in this country. I'm sure when they started giving back people who own houses some of their whatever they pay in interest back, they said that would be unsustainable. But it has continued, it has continued. So I don't think that simply having an account without the financial training and mentorship which go with it makes a difference. I really don't believe in that. And the reason I don't is there are so many parents who have, especially middle-income people, who already save for their kids. They're already doing that. But I think partly what makes a difference, which actually, I like your question, because maybe, yeah, then I should go ahead and test out that, is the mentorship and the training that go with how to handle this account. Not simply opening an account and leave it there, but taking the child in, this is your money, this is how you'll use it, this is how you'll, if you don't save, this is whatever, and that kind of stuff. I think that is a package. So one time I was thinking about something different, something similar to that, and the reviewer at NIH said, why do you break something which is already working? So they were like, why do you want to unbreak? You already know that this intervention as a package is working. Why do you want to still tease it out? And the question was about sustainability. So I couldn't allow them, they couldn't allow me to do it that way, but they said, how about if you tease out a 2-to-1 match rate versus a 1-to-1 match rate? And so now, actually, one of my studies is doing 3 groups. No match at all, 1-to-1 match rate, and 2-to-1 match rate. And then we are looking at the cost benefit with that. So yeah, but that's a good way of thinking about it. Yes, please.
Thank you so much for the presentation. I'm just curious, I think it's really cool that you're partnering with the MasterCard Foundation and the banking leaders of the community, and I'm wondering, going forward, do you see more partnerships with the private sector for your work, for NGOs in Africa in general?
Yeah, I think that's the only way we can do sustainable development. I don't think that really, I think the model of social work where they look at capital as evil and private sector as evil is not sustainable. It's really, we have been into this for the last, since I don't know when, where we give handouts and second-hand clothes and Salvation Army, which is great. All I'm saying is that satisfies a part, and I'm not saying take away, scrap that. I think that plus connecting people to the private sector is what is going to make a difference. The world is moving so fast, and if the world is moving so fast, we can't have a group of kids or a group of a population excluded from the financial sector or excluded from the formal market and that kind of stuff. That's what I think. So going forward, yeah, I have about 3 emails, all of them from different banks. And when I went to Uganda, 2004, when I went there and I talked to banks, none of them was willing to work with these kids. None of them. They said, no, it can't work. No. Who is going to save? They are all. I have an email from one of the bank officials saying, Dr. Ssewamala, I think you'll be proud to know that we have established a child savings account, and this is how it works. We put in this amount of money, and that money, and the way they have designed it, they have also put their an insurance product as part of that, which is very, very creative. So I think people have realized that the future, the way people thought about China 10 years, 15 years ago, or 20 years ago, that would be, and now they are reaping. I think some people are realizing that the youth, the young people in Sub-Saharan Africa, that's the future. People are getting educated, people want to interact with the financial sector, and they are going in. So yeah, so these partnerships are going to be there. And I think that line between, civil society, no, evil capital, and let's work together as a collaboration is getting smaller and smaller and smaller and smaller. Okay? Other questions? Yes, please.
So wasn't that
between disenfranchised populations and very powerful. How do you kind of fight that moving forward in terms of sustainability with allowing those two to move forward on an equal footing as opposed to one being more oppressed?
Yeah, and by the way, I have to admit that I was a very critic of the World Bank, and so I can empathize with that in terms of people. World Bank is evil, so we always say World Bank is evil and the UN is the good thing. I think the way we should look at this is the financial management trainings that are going on, okay, and the mentorship that are going on. That's why I want to keep that as part of the intervention, because you want an informed buyer, an informed customer. So they need to know, if I go in and interact with a bank, okay, and they're only pushing credit, I should step back and I say, you know what? I should think about savings. How do savings work? So even with the crash here, most people borrowed money than what they could afford to pay back, simply because I think partly we lack the financial training piece. If low-income families had that and they knew, you know what, you can't pay more than 35% of your income on housing, let me not go, then it would have been different. That's why right now, City Foundation, in fact, they want to fund part of my work, they are looking at this in terms of financial management, financial capability, financial training. They are telling us that, you know what, it's better for us to work with an informed customer than people are borrowing money, and sometimes we are not able to cross all the T's, and all of a sudden they lose out. So you always have to make it such a way that the the private sector is seeing a case for it, but also the individual is an informed buyer. And if it means getting these classes into schools, actual schools, where either all social work students have to take a financial management course, or all primary school kids have to take, starting grade 5, something on financial management, let's do it. But I think we need to think about this way, that there's no way you can survive without interacting with the private sector. Okay?
I think we'll have to call that, and we'll let you have the last question. Thank you very, very much.